Hi, my name is Lauren Westmeyer. I'm a junior in the Allied Health College at the Ignite Institute, and I will be talking to you about the silent killer cervical cancer. Cervical cancer is the cancer of the lower part of the uterus. This is called the cervix. The cervix is built of a couple of muscles. If we use this diagram here, not built to size of the actual uterus, these are the walls that are covered with muscle. This part right here in the bottom will be the actual cervix. The cervix is about the size of a quarter, with a small opening the size of a pinky finger nail for insertion. This is where a female will insert things like a tampon. During her period, the cervix itself is holding the tampon inside, so it doesn't just fall out. This is very important for other things, just tampons, like children. When somebody is pregnant, the cervix is what is holding the baby inside. That is why this cancer can get so dangerous, is because if the cancer spreads so much, the muscle gets so weak that it is no longer safe for the female herself. There are two ways of getting this cancer. The first way is by a sexually transmitted virus known as HPV. HPV is more common than most people know. About every 4 out of 5 people get some kind of sexually transmitted virus. HPV can go away by itself, but may need treatment. An additional way of getting this cancer is by the BRCA gene. The BRCA gene is passed down from mother to daughter, generational. This gives you a 65% chance of getting cervical cancer or breast cancer. So the BRCA gene is a mutation on the C5 band of data. When you have it, you can't build immunity to fight the cancer cells. So when the cancerous cells come to appear on a normal person that doesn't have the gene mutation, then that gene would now fight the cells. But without it, then they just grow, and then that's what's called cancer. There are 4 different stages of cervical cancer. The first stage is really unnoticeable. Many women don't get caught with stage 1 cancer, and it's very sad. This is because the more stage 1 and stage 2 are very similar. So in stage 1, the most you will feel symptom-wise is slight discomfort. This is many times compared to as period cramps, things like that. And many women don't really understand what's going on, so they don't see a problem. If you do catch it during stage 1, though, it's only like 2 centimeters in size, so it's really easily gotten rid of. What they do is they do a cone biopsy. Imagine an ice cream scoop and size it really tiny. They take that and then they scoop out the cells and they put it under a microscope and they look at the border of the tissue that they just got out. If the borders are clean, that means they got out all the cells and you are now cancer free. If they are not clean, then you then they will do another cone biopsy. They can do a total of 3 cone biopsies before the cervix itself is no longer safe enough, and then they automatically have to do a hysterectomy. Stage 2 cervical cancer, like I said, is really common as stage 1. During stage 2, you're just going to have that slight uncomfort, and then the only other symptom that you might have is slight uncomfort during intercourse and slight bleeding during or after. A lot of women cause this off as discharge, and they just kind of throw it off because you can't really tell. A lot of women don't report it. They report having the symptoms but not really realizing that something was wrong because of the symptoms. Once again, you're gonna go ahead and you have your hysterectomy side of treatment, and then they could do chemo and radiation to shrink the tumor down to try to do that cone biopsy. Of course, once again, the max is 3, and then you'd have to do a hysterectomy. Now, from stage 2 to stage 3, there's a very big difference in the size of tissue that is covered. So it is from 3 centimeters to 7 centimeters. So 3 centimeters or more to 7 centimeters is all stage 2. Once you hit 7 centimeters, that's over 95% of the cervix itself. So now it is considered stage 3. During stage 3, a lot of symptoms come out. This is when most women actually identify that they have this cancer. This is because you're going to have a lot of pelvic pain, and the pain is no longer going to feel like a light cramping, and it's more going to feel like a constant stabbing that just won't go away. Of course, then the bleeding will continue but will get worse, as well as a loss of weight, the nausea, and then not being able to eat, and fatigue. The ways of treating this is, once again, chemo and target radiation. So they would do that and try to make it small enough to do the cone biopsy, but most of the time, it's 7 out of 10 times, women go for a hysterectomy, just because once you get to stage 3, it's very easy to get to stage 4 because you're just on the borders of going over the entire cervix, so it can spread to other organs. And that leads us to stage 4. Stage 4, you only have a 16% chance of surviving more than 5 years, so it is very deadly. You can go from stage 1 to stage 4 within 2 months, so being able to catch it fast is really important. During stage 4, you have no chance of having kids ever again. The cancer has spread not only over your entire cervix, but also into the uterus, the bladder, and sometimes even the rectum. You can't have a cure for this, of course, because there's just no cure for it, but they will do things to help the symptoms go away for the treatments. They can give you medications and things like that. Unfortunately, that's really the only ways to stop cervical cancer, is to find out about it before it gets to stage 3 and stage 4, with the pap smear being the only test that you can do after the age of 16. We recommend that everybody go get tested once a year. Many women actually get cervical cancer after they have children because they stop getting pap smears. They just forget to, or they don't have enough time, they put it off, and that's when the cancer gets them. So I recommend that everybody go get your pap smear, and thank you for listening.